Psychedelics and addiction recovery. What is the history of psychedelics? Psychedelics have been used for centuries in various cultures for spiritual and healing purposes. Can psychedelics be effective in treating addiction? Yes, recent research has shown that psychedelics such as psilocybin and ayahuasca can be effective in treating addiction to drugs, alcohol, and tobacco. Do people who use psychedelics have lower rates of addiction and mental health problems? Yes, studies have found that people who use psychedelics tend to have lower rates of addiction and mental health problems. How can psychedelics help people with addiction? Psychedelics can help people with addiction by altering the brain's reward pathways and reducing the power of negative memories and emotions associated with drug use. What is psychedelic-assisted therapy? Psychedelic-assisted therapy involves using psychedelics in a clinical setting under the guidance of a trained therapist. Is the use of psychedelics in addiction recovery controversial? Yes, the use of psychedelics in addiction recovery is still controversial, and more research is needed to fully understand their potential benefits and risks. Are psychedelics physically addictive? No, psychedelics are not physically addictive and do not produce withdrawal symptoms. What other mental health conditions have psychedelics been studied for? Psychedelics have also been studied for their potential to treat depression, anxiety, PTSD, and other mental health conditions. Could psychedelics eventually be approved as prescription medications for addiction treatment? Some experts believe that psychedelics could eventually be approved as prescription medications for addiction treatment, although this is still a long way off. What is the broader trend in addiction treatment that includes the use of psychedelics? The use of psychedelics in addiction recovery is part of a broader trend towards a more holistic and individualized approach to treatment that takes into account the emotional and spiritual aspects of addiction.